How can primary progressive MS be misdiagnosed? Imagine trying to solve a puzzle where some pieces look very similar to others. That's often what doctors face when diagnosing primary progressive multiple sclerosis. It can be tricky because its symptoms often resemble those of other neurological conditions. Primary progressive multiple sclerosis is marked by a steady worsening of neurological function over at least 1 year, without clear relapses or remissions. This gradual decline can make it hard to distinguish from other diseases that cause similar symptoms. One reason for misdiagnosis is that the symptoms of primary progressive multiple sclerosis are not unique. Muscle weakness, stiffness, problems with balance, and bladder issues are common in many neurological disorders. Conditions like spinal cord diseases, neuromyelitis optica spectrum disorder, chronic inflammatory demyelinating polyneuropathy, or even degenerative spinal conditions can look very similar. Because these symptoms overlap, doctors need to carefully evaluate to find the true cause. Another challenge is that primary progressive multiple sclerosis does not have the clear attacks or flare-ups seen in relapsing-remitting multiple sclerosis. Without these episodes, the disease can be mistaken for other neurodegenerative conditions that worsen gradually over time. This absence of distinct relapses can delay diagnosis or lead to confusion with diseases like amyotrophic lateral sclerosis or hereditary spastic paraplegia. Imaging tests like magnetic resonance imaging are crucial but can also be misleading. In primary progressive multiple sclerosis, MRI scans may show fewer or less typical lesions compared to relapsing-remitting multiple sclerosis. Sometimes, lesions are absent early on or are nonspecific, which can cause doctors to overlook multiple sclerosis or consider other diagnoses. Cerebrospinal fluid analysis, looking for immune markers like oligoclonal bands, helps but is not definitive on its own. The diagnostic process relies on established criteria, such as the McDonald criteria, which requiring evidence of disease progression over at least 1 year, along with MRI and cerebrospinal fluid findings. However, these criteria are complex and requiring careful interpretation. If a doctor misses key signs or does not fully evaluate, misdiagnosis can happen. For example, a patient might be diagnosed with a spinal cord disorder or a different neurodegenerative disease instead of primary progressive multiple sclerosis. Because there are no single tests that confirm primary progressive multiple sclerosis, diagnosis depends on a combination of clinical history, neurological exams, imaging, and laboratory tests. Variability in test results and how they are interpreted can add to the uncertainty. Sometimes, doctors need to observe how symptoms evolve over time before making a definitive diagnosis. To reduce the risk of misdiagnosis, neurologists often take a thorough approach. They carefully assess symptom progression, use advanced MRI techniques to look for characteristic lesions, analyze cerebrospinal fluid for immune markers, and rule out other conditions through additional testing. Continuous follow-up over months or even years helps clarify the diagnosis as the disease pattern becomes clearer. Understanding how primary progressive multiple sclerosis can be misdiagnosed emphasizes the importance of seeking care from experienced neurologists. Accurate diagnosis is essential for providing the right treatment and support. It also highlights why ongoing monitoring and comprehensive testing are vital. Patients should always discuss their symptoms openly and ask for a detailed evaluation to ensure they receive the correct diagnosis and appropriate care. Remember, every person's experience is unique, and diagnosis should always be personalized and based on the best available evidence.